well, let him introduce himself. Sorry, over to you, Mike.
Good afternoon, everyone. It's fantastic to see you all. Penhamda or Cardiff. I'm in Canton in Cardiff. I'm aware that we've been listening to some fascinating contributions this morning and this afternoon, but it's an hour you've been sat there listening. So I don't want to sort of, I've got the graveyard slot, I guess, at the end of the day. So if you need to have a little break, if you need to pop to the loo or make a coffee, do that. I won't be offended. I won't hold it against anyone. And I'll just sort of, you'll be able to catch up on what I'm talking about. We've had, theoretical, international, national perspectives today. In the program, it says I'm going to sort of talk local, but it's not Cardiff and Vale local. It's kind of bringing it back to what's local for you. Because after all, everything that's local is also universal. And some of the principles about what, for instance, we've been doing here in Cardiff and the Vale will be replicated elsewhere, have parallels and similarities. So I'm going to talk a little bit about my role. I work for Sefyll. Sefyll, for those who understand a bit of Welsh or speak Welsh, is to stand. And it's a project part of cavamh, which promotes the voice of mental health adult service users, people who are either in the system or have recently been in the system and can make some sort of contribution in a co-productive and involvement sense to the promotion of insights around current services, but also the planning of new services. My background is that I've been working for about 40 years and I've done lots of things, community work, advocacy, mediation, social work. Most recently, I was lead manager for Substance Misuse and Homelessness social care in Cardiff. So I've done lots of things and I became an advocate. But these last 4 years, I think, have been the most fulfilling work years of my life. And I want to pay tribute. I don't want to get overly sentimental, but pay tribute to the individuals that I've come across in Cardiff and the Vale, service users and carers, and the people who preceded them, who have achieved a huge amount. And this event would not be happening because we wouldn't have in Cardiff and the Vale the superstructure and context to be able to sort of talk about the things we've been talking about. These service user and carer reps have plugged away for many years, and often it's one step forward and one step back. And it's often frustrating. And I came in 4 years ago when we were probably going through a frustrating phase in terms of service users and carers' relationships with statutory services. But people have kept pushing at doors, management has changed, the culture has changed, the context has changed, the national Welsh culture and broader culture around the ethics and morality around using people with lived experiences to inform and develop services is now becoming more and more mainstream. These people who have been doing this in Cardiff and the Vale for 15 or 20 years are inspirational, and many of them are here. You know who you are, and you are massively valued. And they have kept going. Talking about sort of some of the principles, behaviors, attitudes, values, we can't generalize, but if I had to sort of talk about the sorts of people that I've come across who are reps within the structure that I'm involved with. These people are kind, they're supportive, they're self-supportive. As a peer group, they are fantastic, but these people are open-minded. They can also be very flexible and they want to work collaboratively. What they don't lose, despite some of the challenges that happen, is their enthusiasm. And to a man and woman, they are fearless. And often within the backdrop of volunteering as reps, the individuals we're talking about are often living with very challenging personal issues and health challenges. So to keep going in that context is massively impressive. I know Margaret earlier said, well, perhaps we haven't done very well. And I know we could do better and could have done better. But when I came in 4 years ago, I saw things in Cardiff and Vale that really I don't think were happening anywhere else in Wales. We had service users as trainers, peer trainers, delivering how to live well with mental health to others who were going through mental health challenges. Got peer researchers who do professional social peer research into mental health, aspects of mental health when commissioned by the Health Board. We've got reps throughout the planning and recruitment structure, and the local mental health partnership board, which is at the apex of the planning structure, is chaired and led by service user and carer reps. There was a long challenge for their representation work to be recognised in terms of remuneration, and the remuneration structure was established. Carers and service users developed a recovery agenda, which led to a very successful recovery college about 4 or 5 years ago. Out of that, a recovery college has been established. I don't think without the involvement of key people with lived experience would that have happened in the time scale it has. The widely adapted mental health charter was formed by the people that we're talking about. And the case for a peer lead and senior role in the clinical board of the UHB, which has just been, I'm glad to say, appointed to, with Alex in her position, was part of the part of the same struggle really to get co-production and involvement at the heart of what services do in Cardiff and the Vale. It's not always easy. There are tensions, often there are tensions, but it's spirit of cooperation between people with lived experience and the people who design and run services and manage services from the top to the bottom. It couldn't have happened without the cooperation and the co-production. I've sort of gone off piste a little bit about in terms of what my brief was. If I achieve anything, or we achieve anything from this brief session, is I hope that you will be able to take away some concrete actions or plans on the personal or organizational level for co-production. So we're going to go into, we're going to go into breakout groups for 10 minutes. I'll describe the task now. My technology hasn't been working very well today, but I'm going to try and come up with the context for our discussion, and I'll try and make it bigger. So it's about bringing co-production home, wherever home is for you. This is the task. Think of a service provider or group or organization that you know well in your life. It could be a service in social and healthcare, it could be a third sector organization, social housing, government department, etc. It could be a local social club or sporting club. It could be in your personal life. It could be a family or a social group. You could be a user of the service, a carer, an employee, a tenant, a trustee, a group member, anything. So you could be talking about your family. I've got youngish children, well, late teens, and when I got my job, they were curious about what I was doing and said, come on, Dad, can you be more co-productive in terms of how you manage or how we manage decisions within the family? So that it could be something as local as that for you. So thinking about the organization or the group or yourself, question one is to rate how the service, organization or group or yourself are doing co-productively in relation to activities that are legitimate for a co-productive approach. Co-productivity, as we have heard, rightly so, is not applicable to all human activities. It has to be applicable to those where it can work. And think both in terms of culture, attitudes, and organization. So it might be an action, practical action, or it could be something which is more diffuse than a concrete action. And then to think about 2 realistic steps that could be adopted to nudge the service or group in the right direction. So it could be a personal action that you could undertake, or something the organization or group could do. So we're planning to have about 10 minutes in the group and 10 minutes for feedback. It's the end of the day. I'm very open to a very free form, organic discussion, whatever works, whatever